This young couple just celebrated 5 years of marriage together. The husband works a part-time job during the day and a full-time job overnights. The wife also works and is 7 months pregnant. This beautiful young family receives benefits such as food stamps, Medicaid, and WIC to help prepare them for the arrival of their firstborn daughter in mid-June. Now, despite all the naysayers and all the stigmas that have been plastered on top of welfare, as it was designed, it's been an avenue for improving American lives for nearly 90 years now. Now, I know, no matter what program or system is created and implemented, there will be someone who abuses it. There will be those who take advantage of its benefits. However, I think we need to focus on who the program was intended for. What was its purpose? In order to adequately discuss this, I think we need to look at the history. Where did it come from? The reform, how has it changed? What is it today? And then the types of programs that are included. Are we even thinking about the same thing? Are we talking about the same thing? So first, allow me to give you a very brief history about the founding intentions of welfare. If you go online to welfareinfo.gov, it gives a brief history stating that in the 1930s, during the Great Depression, the U.S. government saw a need of many individuals and families with little to no income. So they created a welfare program. Moving up to 1996, President Clinton signed a reform law that gave control of this welfare system to the states. Okay, great. So how does that translate to the system we have today? Well, if you read the article by Stephen Mangala, who is the senior editor of City Journal, he wrote the article called Welfare Reform is Working. It states that the 2005 bill really embraced the work first philosophy. It explains that every state has to meet a certain requirement about the number of welfare recipients who are guided into the workforce. And in the article, he highlights the company CVS, who's really provided a smooth transition for the said mentioned people back into the workforce. They do this by working very closely with state agencies. They fill their entry-level positions with those who are receiving welfare benefits. But even beyond that, they offer training to any of their employees who are willing to apply themselves to work up and gain the necessary skills for higher paid positions. So that's just one example. In 2008, we read of a single mother. She has 4 boys, and she applied for food stamps. She was denied because her monthly income was $50 over the designated level. In Jennifer DePaul's article entitled Access to Food Stamps is Essential for Needy Families, Perkins, the single mother, is quoted as saying, it was disappointing, but I toughed it out anyway. She still managed to feed her family by creating a budget and sticking very strictly to it, and learning how to shop with coupons and buy what was on sale. This article further explains that in 2010, the Obama administration, they adjusted the qualifications so that more families would qualify for food stamps, or what is known as the Supplemental Nutrition Assistance Program, or SNAP. And just a little over a month ago, USA Today published an article that had the following statistics from the Center on Budget and Policy Priorities. It states that, first of all, the number of welfare recipients has fallen steadily in the past 2 decades. Whereas in 1997, there were 4 million adults on the Temporary Assistance for Needy Families, or the TANF. In 2016, this number was reduced down to 638,000 adults. Ronald Reagan is quoted as saying, "Welfare's purpose should be to eliminate, as far as possible, the need for its own existence." And that really is truly why the welfare system was created, to offer temporary assistance to those who need it for a time. Every state has its own requirements for who's eligible for welfare benefits. However, again, on the welfareinfo.gov website, it gives a basic list, starting with commitment to self-sufficiency. And it says on there that the head of the household will become self-sufficient within a certain time frame. Again, this isn't meant to be a long-term thing. This is just a supplemental help for a certain time. They have to commit to cooperate with the regulations and requirements, must be a U.S. citizen, and they have to establish and adhere to a financial budget. This really is a program to help people improve their quality of life. Okay, so what does welfare include? Again, on the same website, the welfareinfo.gov, it lists several different programs, and just to highlight a few, as has been mentioned, the TANF, the Temporary Assistance for Needy Families. It brings income into households to help care for the children, the elderly, and the dependents. However, one of the main criteria is that the head of the household has to be working to obtain job training, again, to enable them to leave the welfare program. Also, child support, so that while this head of the household is out working or in job training, their children will be cared for. Food stamps provide nutritional needs for families, and it really frees up their income so that, well, their groceries can be taken care of, so that what income they have can be spent on other bills. However, food stamps, you can't just buy anything with them. There are requirements and limitations on that. Medical assistance programs, Medicare and Medicaid, provides necessary coverage for doctor visits, prescriptions, dental care, eye care. Okay, there are two sides to every coin. We just have to be willing to look at both of them. So today I took a few moments to share with you the history, the reform, and the types of programs included in the welfare program. I really want us to be able to applaud the individuals and families who are not too prideful to admit that they need some help for a time. They want to better themselves. They want a better life for their children, for a future. You know, there may even be classmates who are listening to this presentation who also receive benefits similar to this family as pictured. So if legislation wants to make a move to diminish the aid given to families and fellow classmates, are you going to support and vote to take that away? Are you going to take the groceries away from those who are really trying to prepare a good, healthy environment for their unborn child? Remember, welfare as it is defined is all about the good fortune, the health, and the happiness and prosperity of people. Who could possibly want to put an end to that?